Doctors have read it. What are the dead giveaway signs that someone is faking? I'm a nurse on a floor that deals with a lot of chronic and acute pain patients. Most recent instance was this lady from a few weeks ago that was apparently splitting the oxycodone we were giving her in half in her mouth, and then when the nurse's backs were turned, she would stuff it in a pill jar. A night nurse caught her in the act and all of her crap had to be searched. We found 20 half tablets of oxycodone she had been stashing. She told us that she was saving them for her family in case they need them because it's just so hard to get an oxycodone prescription these days. I had her a few days after that and she was having some abdominal pain. Stat x-ray showed only gas. She just really needed to fart. But she was screaming, claiming it was a 10 and making a huge freaking scene. She demanded Dilaudid through her IV and she wanted it to be pushed fast. Huge red flag right there. She wanted the not the relief. Doc straight up said he wouldn't give her Dilaudid because she was already on so many opiates. She then demanded lorazepam. Still through her IV, of course. Doc was like, fine, whatever. Just one time and only a low-end dose. I was flushing her IV with normal saline first, to make sure her IV was patent, and she leans back and is like, "Ooh, that is so much better already. Haven't even given her the lorazepam yet." Shaking my head. Story 2. Nurse thought I was faking that I could not swallow when I woke up from jaw surgery. When I came out of the surgery and was panicking telling them I couldn't swallow my own saliva, the nurse just told me, "Yes, you can. This surgery wouldn't have anything to do with your ability to swallow." I could also barely speak and started crying and pleading with her to believe me. Ended up having cranial nerve damage that paralyzed half of my tongue, trachea, esophagus, and vocal cords. It took 8 months to heal. I drank thickened water, which is as gross as it sounds, for 8 months. Having a healthcare professional not believe you during trauma is absolutely scarring. Clarified that the nurse was the only one not believing me. My surgeon absolutely did. It was scary though because he actually looked frightened when he finally came in to examine me like he had never seen this before. Answering some questions. Number 1, surgeon did believe me, and the conclusion they ended up coming up with for the cause was that my nerves must have shut off protectively due to the pressure of the laryngoscope during intubation. Number 2, we did see a lawyer, but they said it's very hard to pursue legal action in malpractice cases because it's very hard to prove. But regardless, if I recovered, which I did, there is no case. Number 3, yes, I realize this doesn't answer the OP's question, just saying that maybe health professionals should be careful when trying to discern if someone is faking it. If they're not, it can be extremely traumatic. Number 4, surgery was for an ossifying fibroma, a benign bone tumor in my lower jaw, and 4 teeth removed and a portion of my jawbone. Number 5, thickened water is water with a thickening agent added, usually xanthan gum. When you have damage to those throat muscles, thin liquids are actually the hardest to swallow. I think mostly due to muscle reaction time. My go-to was thick and easy nectar thickness lemon water. So many questions about the thickened water. Just the thought of it makes me sick. Story 3. I was knocked over and dragged half a block by a concrete truck when I was 8 months pregnant. I had a nasty cut on my arm, so I got an arm x-ray. Luckily, that wasn't broken. I could kind of walk, but my hips hurt. I kept telling them, but they just gave me a simple squeeze and thought it was fine since my response was, "Ouch, that hurts," instead of screaming in pain. I got a scan and they checked the baby's heart rate and all looked fine, but instead of keeping me in for observation, they sent me home with Tylenol. Turned out I was in shock. Surprise. And the adrenaline dulled my pain reactions or something. Also, it turned out I had a fractured pelvis, 3 broken ribs and massive internal bleeding that they would have seen after a few hours because of the bruising and my blood pressure. Lost consciousness at home trying to go to the bathroom. Called the ambulance, but it was too late. I lost my baby and I almost died and then almost had to have my arm amputated. Had they kept me in for observation, they would have seen stats plummet. Had a C-section and things would likely have been okay. So if this can happen after a major obvious incident, then I shudder at all the things that are missed. It was, and continues to be, horrid. Loss of a child is something nobody should ever have to go through, especially if it was preventable. I go to hold him and meet him and give him a name. He's a person and he's my son. I was in a kind of developing country in Southeast Asia, but at an international medical clinic with doctors from France, South Africa, and the UK. I'm not a minority and had loads of insurance. My medical follow-up included a medevac to a different hospital and a private plane with 2 surgeons. The bill was in excess of $300K. I paid nothing. I'm lucky and I acknowledge that. I didn't sue. It didn't cost me any money in cash, and going through it all again to get a settlement wasn't going to help. In my mind, not at the time at least. Story 4. I hate this because I'm pretty injury-prone, but also don't really exhibit pain that much as I've gotten older. Last time I broke my foot, it's happened a few times, I also didn't have insurance. It was one of the most painful injuries I'd ever had. Free clinics couldn't give anything more than NSAIDs or Tylenol. Again, I get injured a lot, so I have a pretty good idea of when it's going to take more than an Advil to get me through. I ended up going to an actual urgent care and had to straight up tell them that no, I didn't need an x-ray. Already had one that they were welcome to look at, but I straight up came to them because the pain was too much to bear and I needed real painkillers. Problem is, I don't really outwardly exhibit my pain, especially not for something like a broken bone, so I wasn't screaming or writhing in pain or even grimacing too much. I also make a lot of jokes when I'm hurt, because I feel weird about people being overly worried about me. I don't know, it's a thing. She ended up giving me 3 Vicodin, which fine, I made them last for the week, at which point the pain was starting to subside, but she also hated me for it. Story 5. Not a doctor, but doctors often think my family is faking. For an unknown reason, when there is something wrong with our organs, our white blood cell count doesn't go up. My young sister got appendicitis when she was in her early teens, crying from the pain, but blood work showed nothing was amiss. If it hadn't been for other tests and my dad's insistence on them, she might not have been treated in time. So they opened her up and surprise, a gross appendix that was close to bursting. My dad insisted because of an operation he had just had to remove his gallbladder. It was in so much pain that he was vomiting, could hardly walk. It had been building up for a while and he was pretty sure what it was. He went to the doctor, but blood work showed his white count was normal. My dad had to scream in agony on their table for ages before they finally gave in and took him to surgery. They go in, see a perfectly healthy-looking gallbladder. They pull it out, cut it open, and sand spills out. Dry sand. We learned later that it had completely stopped working and totally filled with protein chains. It was removed before it started killing my dad in earnest. So yes, people fake it, people lie, but do double-check just in case. These stories took place over a decade ago, so my details were sparse and sometimes incorrect. So after double-checking with Dad, the stuff only looked like grains of sand. They were deformed trypsin protein chains. We learned this when Dad was diagnosed with a rare genetic disorder called alpha-1 antitrypsin FM phenotype. It's not fun. His lungs and liver deteriorate over time because of incorrectly shaped proteins getting stuck in his liver cells and not making it to the lungs, to put it simply. And yes, my dad is being studied. Every time he gets a biopsy, doctors gather data because his phenotype is so rare. And update, I got a couple of details incorrect. It has been a while since this story was told to me. The gallbladder didn't actually look healthy. That was a tidbit from a different story. My father has had basically every organ removed that he can and still be alive. Turns out that my dad found out about the white count thing during his own appendectomy. So later, when he was in pain from his gallbladder this time, he made sure he went to the same doctor he had gone through that whole kerfuffle with, and by that point, my dad's severe pain was enough reason to operate and take a look. They found the most deceased-looking gallbladder they'd ever seen, full of sand. They estimated it hadn't functioned for years. As for the white cell thing, there's a name for it that we've since found that I didn't know about, but no one can remember it at the moment. Sorry. And weirdly, I can't find it on Google. Then this is all exacerbated by biliary dyskinesia. Very small ductwork that is easily clogged. More pain. And to top it all off, Dad was exposed to high levels of radiation as a child. This on top of winning that dumb genetic lottery that no one wants to win. Story 6. I hate this. I went to an ENT specialist once about some issues with my ears that were affecting my hearing and equilibrium. I was having intense bouts of vertigo with a constant, slightly off balance. Instead of focusing on what I was saying was bothering me, he asked me to speak plainly. I guess I was using slightly more technical terms. I couldn't speak plainly because I was busy translating my every word. Since it had been a while since I last spoke the language, I live abroad most of the time and it takes a bit of time for me to switch from English or German to Romanian, plus I had just come back a couple of days before. That made the doctor decide that I was a hypochondriac with nothing better to do than to Google it. In the end, it turns out my vertigo is caused by an issue with my spine, but the ear was plugged up, hence the hearing issues. I had to visit his office three times before he deemed it necessary to use the scope thingy to look into my ear and actually resolve my issue. I felt like I was going crazy for over a week because I kept on hearing everything echoed in my right ear. Also, it turns out I have really narrow and weirdly angled ear canals, and therefore shouldn't use drops most of the time, which he obviously prescribed and made the issue worse. The silver lining is that because of this experience, I learned to push if I was having a medical issue that my doctor would rather ignore. That was how I got my doctor to take my back pain seriously, double-sided hernia somehow, and to diagnose and start treatment of my autoimmune issue. Turns out feeling constantly run down at 23 is not normal. Who knew? Age 23 and constantly run down? Not normal? Dude, half the people I know who are in their 20s look like they've lived 100 lifetimes. I'm pretty sure you're fairly young, but experience all the backaches and pain older people feel. If you do, hit the like button and subscribe to the channel. Story 7. Not a doc, but figured this is a good place for the time I was accused of faking a broken arm. I was somewhere between 4 to 7. It's a blur, so I don't exactly remember when. I'd fallen off of a bed and into a nightstand at just the right angle to really mess up my arm. I was screaming and cried out every time I tried to put pressure on it, lift it, etc. My parents take me to a hospital and get me x-rayed, and the doc asks me how much it hurts. Well, of course, the rest of the night I was subjected to the most intense pain child me had ever had, and currently, I wasn't putting pressure on it. So at the exact moment on a pain scale, I had rated it a 2. The actual injury was a 10, and testing it was definitely high on the scale. Because of my low pain rating, the doctor told my parents I was faking and then proceeded to bill us an obscene amount. We got a call 3 days later. Mind you, I was sent home, no painkillers, cast, nothing. Saying that someone happened to peek at my x-ray and noticed that I had a pretty large fracture in my elbow. Said I had to come in and get a cast and more x-rays. I'm still pissed at the doctor to this day because he made me, a child, feel like a liar to my parents. Made me feel like I was being a crybaby. And then made me have an untreated fracture in my arm for 3 days. Story 8. Not a doctor or a nurse, but as a patient, it's really messed up when they think you're faking. I had an extremely bad year last year and was almost daily losing consciousness. Couldn't keep food or some days water down. I collapsed one day after having horrible stomach pains. The ER doc, doing his job very quickly, assessed me and had them give me Dilaudid, thinking I was probably going to be rushed into surgery for gallbladder removal. At the time, this was understandable. However, this particular medicine made me become completely unconscious. They were then not able to do my intake or ask me additional questions. The next doctor assumed that I was on substances because I shouldn't have had that reaction. He ran all sorts of drug panels on me and they, of course, all came back negative. They then had to give me Narcan twice to bring me back as I was out for much longer than I should have been. I'm much better now, but that was an absolute horrible experience. I don't remember all of it, but I do remember my sister, who was there with me, was in tears from how I was treated. She's a medical professional herself and could not believe what was happening in her own hospital. The doctor who thought I was on substances no longer works there. Story 9. Vital signs. If you say you're in excruciating pain but your heart rate is 65, then I'm pressing X and doubting you. If you are short of breath but you're breathing at 12 times a minute, normal instead of fast, and your oxygen saturation is 100%, then the problem isn't in your lungs. Anxiety can present like this, which isn't faking it, but it requires seeing past what the patient is telling you. If you tell me you've been clean from ice for a month but your heart rate is 120, then I'd like you to pee in this cup. Story 10. I worked in the ER with this one doc. We had a guy come in unresponsive with his girlfriend. Per the GF, they had both eaten a grass brownie and then when they didn't feel anything, ate 2 more. Big mistake, by the way. She was hysterical and convinced he was dying and kept wanting us to send him to surgery. And do what? Dude did not respond to anything but was absolutely fine. Doc ordered like 2 liters of saline IV, turned to me and said we'll see if he's dedicated to this bit enough to piss himself. Sure enough, half an hour later, my man is up and sprinting to the restroom. Another time I was working at a rural ER and this lady comes in with her husband complaining of abdominal pain. Doc swears he's seen her before and I pull up her prescription history and she's one of those people who just bounce around trying to get an opiate script from anyone. We hit her with a GI cocktail, but lo and behold, it's not even touching the pain and I have a very high pain tolerance. Sure you do, sweetie. My friend told me that D medicine works, Dilaudid or something. Sure she did. I think it's because I haven't pooped in like a week. Doc goes, well, we can't give you any Dilaudid because that would make your constipation worse, but if it doesn't get any better, we can try a manual disimpaction. Silence. Husband goes, oh no, she doesn't like nothing in her back door. Believe me. She took a trip to the bathroom and it was magically better. Had me rolling. If you're trying to game the system, don't use constipation as your go-to. Try a kidney stone or something. I think that's the only thing I've ever seen work. Dude came in claiming a history of kidney stones with symptoms, posture, effect all consistent with kidney stone presentation. In a patient like that, you hit them with the pain meds first because kidney stones are indeed torturously painful. So that's what we did. Ultrasound and CT both come back negative for calculus. My doc was livid, but to his credit, the dude was a great actor. In this case, giving the patient the worst cure makes them feel much better. Story 11. I'm a 37-year-old woman who, when I was 35, went to the doctor because I needed a physical after going 20 years without having insurance. I was doing a bunch of initial crap, including behavioral health, and was noticing some dry mouth problems. Mentioned this during my physical, and my doc screens me for a bunch of stuff. Comes up there is sugar in my urine, and my blood tests came back with a 3-month average blood sugar of 400. So it's diabetes then. Only he diagnoses me as a type 2 despite that I'm extremely active and borderline malnourished, kind of skinny. He berates me a little for possibly having a fatty liver or something and off I go with pills. They work a little. I go full paleo, nuts, meat, fruit, veg. No more processed sugar or grains. I don't have the energy to work out any more than I already am. The pills still don't work very well. I'm still testing high all the time. I start dropping weight. I go down to 92 pounds. I complain to the doc who says I must not be trying hard enough. Am I sure I've been counting carbs? Have I been having candy? I break down. I'm miserable. I feel sick. My vision starts to go blurry so I can drive at night after work and I'm starving. I'm always hungry but terrified of making my glucose go up. I start to really think that people who make fun of diabetics are monsters. I'm taking 5 pills a day. My colon produces a smell from one pill that makes my fart smell like rotting zombies trapped in a full latrine after the platoon has had food poisoning in the full heat of summer. Finally, after 7 months of eating nothing but twigs, berries, and meat, smelling like an open sewer and losing every bit of extra weight I ever had in my life, Doc sends me to an endocrinologist. Endo takes one look at me, listens to me talk for 5 minutes, then rushes me for a peptide test, which reveals that I am, in fact, type 1.5. Type 1 that shows up in your 30s randomly by genetics or something. They don't even know it's an autoimmune disease. I go on insulin. My glucose is normal within the hour. 7 freaking months. 4 of those were spent questioning whether it was me or him. I felt like I was dying, but it was never that bad. I hadn't seen a doctor in 20 years, and the first one I see is either a quack or doesn't listen to women at all, and my life was nearly ended by it. My husband sees him and says he doesn't have a problem communicating with him. They just don't listen when you say you're in pain or that you're feeling unusual. They just kind of chalk it up to you being a lady and maybe some kind of lady issues that med school just doesn't teach. I'm getting an Apple Watch so at least I can carry proof of my stupid panic attacks with me everywhere, so Lord forbid my psychiatrist doesn't think I'm those too. If you thought these stories were wild, get ready for more in the next videos. Doctors, what's the dumbest self-diagnosis you've heard from a patient? Story 2 will make you question what goes through people's heads. See you there.